Hello, I'm Laura Huddleston. I'm a licensed professional counselor, and I am currently a second year doctoral student at the University of Georgia studying counselor education and supervision. Today, I would like to talk to you about counseling older adults and the need for trained counselors. Each day in the United States, 10,000 people are turning 65 years of age, and the life expectancy in the United States is 79.5 years. There are many countries around the world which have even higher life expectancies. The World Health Organization predicts that the number of people in the world age 60 and over will be 2.1 billion by the year 2050. About 14% of people over age 70 in the world live with a mental health disorder. Older adults are at greater risk for loneliness and social isolation due to factors like underlying disease and poor cognitive functioning. And in the United States, 35% of Medicare beneficiaries have a mental health diagnosis or have utilized mental health services. Living longer is a worthy goal if people, as they extend life, have meaningful relationships, work and hobbies, other forms of health, such as psychological wellness and spiritual wellness. However, there is a problem. There is currently a shortage of mental health providers. This includes all of the mental health disciplines, such as addiction counselors, marriage and family therapists, clinical social work, mental health counselors, psychologists, and psychiatrists. And there are substantial shortages expected by the year 2036. To compound this problem, there is a need for mental health providers who are trained to treat older adults. Most counselors who work with older adults do not have recognized credentials for working with this population, so it's really difficult to estimate the numbers of providers who are serving the population. Many mental health professionals are not adequately trained to work with older adults, and aging is not a specific competency in many mental health training programs. One example is psychologists. Few psychologists specialize in geropsychology. However, a third of psychologists report that they frequently serve older adults. Please consider working with older adults and seek out the training you need to competently treat this population. Until mental health training programs incorporate competencies in training older adults, we, as mental health professionals, will have to access continuing education trainings, read articles and books, and seek supervision with supervisors who are experienced in treating older adults. There are some training resources. For example, the American Mental Health Counselors Association offers this credential of the Clinical Mental Health Counseling Specialist in Geriatric Counseling. TPN Health offers this gerontological certificate counseling program, which is supported by the Association for Adult Development and Aging, which is a division of the American Counseling Association. This association has conferences, they have a journal that you can subscribe to, and you can find more information on all of these websites. Here are the references I used, and I would want to strongly encourage you to consider adding older adults to your counseling practice, and please find training to help you serve this population. Thank you.